This is really our final interview today, and I'm really, really pleased to have Henry Albrecht, who I've known for now about 8 or 9 years, who founded, with a wonderful team in Seattle, based in Seattle, a company called Limeade. And he'll tell us a little bit more, maybe even why it's called Limeade. But what I want to do with Henry, and welcome Henry, thank you for being here.
Phil.
And also thank you for sponsoring this event. I know you've done it several years in a row, whether it's exhibitor or general sponsor, whatever, but it's really important to have you guys in the ecosystem, so thank you. So I've been asking really of all the interviewees today about the theme of being pace, process, performance. And to me, they're very different objectives. Which one of those is really that you can really hang on to and say, with at least your population you serve as a wellness and well-being platform and company with some really stellar relationships you have with clients and conference board members and not, which one can you hang on to that really you have an impact?
I always love the word performance. First of all, I'm a bit of a jock and a competitor, so that has an aspirational tone to it for me. I think performance also is, finally we're getting to the point where well-being is being connected not just to health or HR outcomes, but to real business performance outcomes. So that's been, kind of the simple story in the market is invest in the well-being of your people. They will be more engaged in their work and they will deliver better performance, better earnings per share, better revenue growth. You'll be a great company, you'll win the awards that these companies win. So that equation is of great interest, and I think it's more about performance than anything else.
Well, that really obviously speaks to your probably your value proposition when you go into these procurement deals with corporations. Now, I'm interested to know your perspective on, we've heard this conference, one of the themes early on was wellness back 5, 6, 7 years ago, and then it's kind of evolved into well-being. Are those terms synonymous, and if they're not, why not?
Yeah, first of all, I didn't come from the health or even the wellness industry. I came from the software industry, so we thought it would be an interesting concept to measure and improve well-being in the world. And so we started from that place. I think we've gone from love, hate, back to love in well-being, frankly. Love was, in the early days, it was all passion. And then in the market, especially in 2008, 9, 10, it was all about cost cutting. It was all about, let's find the most expensive, unhealthy people and deal with them and call them and pick them out of a lineup and help save our medical loss ratios and our health costs. And I would call that, the bulk of the wellness industry essentially was a little more disease management than it was wellness. We didn't always embrace that, but that's what was being sold. Now I think there's an awesome resurgence in well-being, and companies are looking not just at a broader definition of well-being, emotional, work well-being, physical, all of the things that go into well-being, but they're also tying it more measurably to some of the business outcomes. So I've never really loved the word wellness, to be candid. It's not my favorite word.
I don't know if it's a dying term.
It's nice to have a market, though. When you say we're in the wellness market, it just means great. Then I know what I'm buying. Then in the wellness market, then you differentiate on well-being, on whole person, whole population well-being. And then there's a second part to well-being that I think is being missed, actually. And this is a huge area of interest for me, as some of our founders were org psych and organizational people too, is what we would call organizational support for well-being. Not just do you have programs for individuals that are fun and social and game-like, but do you have the leadership support, the policies, the procedures, and the true commitment to how managers talk to their people about well-being? And that to me is really thrilling. And some people are talking about it here at the conference.
Well, that's good, because I wanted to ask, what are you seeing as a thread? If that's one of them, expand on it, or tell me about others in addition, that you've heard in the last several hours, because this is the first day, and since this is our last interview, I wanted to kind of get a sense of what you've heard.
Well, first of all, I unfortunately sometimes only get to see a small part of it, and a lot of that's related to the wellness market or the well-being market. I think the two big themes I've heard this year are financial well-being and the integration of all these resources into a cohesive whole. The financial piece, I think employers are seeing all the data that one of their big challenges is stress, and then they peel back and they see, where's that stress coming from? And a lot of it is coming from not knowing how to manage your finances right, not being paid enough. A lot of the challenges are financial in nature.
Okay.
That lead to physical. So we're always interested in what's underlying
Interesting.
the physical and emotional health, and sometimes it's money worries, especially in lower paid populations. So that's I've heard that from several people. Comcast spoke at length about that. I thought it was interesting. The integration piece is there's so much innovation at this conference. It's a great conference, and the buyer sometimes can be overwhelmed by all of that, and they say, well, can I get this and this and this and tie it all together?
Right.
And that's the integration of all these applications and innovations is super important. I think the hardest part to do of that, by the way, isn't the technology. It's the customer service and delivering a safe, stable, risk-free launch, concierge service, white glove service to customers who have been burned maybe in the past by the promises of everything working perfectly.
Yeah, I think the benefits world, unfortunately, particularly for larger employers, can be very complex, and that's why the conference board members and others, have this conference specifically on healthcare, is because there are so many options to look at, obviously, but also, there is also the complexity of integrating them together. So there's single sign-on, it's going from one portal to the next. So you want to have some kind of seamlessness, but at the same time, you can't have one vendor do it all. It just doesn't exist.
No.
You don't pay claims, for instance, and you probably never will as a Limeade company.
Probably not.
Right. But what you do is so important to that whole experience of healthcare and well-being and wellness. I want to go to a slide for a second, if we could, about the Gallup Healthways study and community well-being ranking and analysis. And you look here on the slide, you see that by community, in terms of the highest well-being communities, you see them here in California and Texas and Minnesota and different places. What that's a factor of, we don't necessarily know. But getting back to what you do with your clients and speaking more about employers who make up those communities, is there anything you've done in terms of indices to look at the well-being index?
So, big fan of what Gallup and Healthways have done, even though we compete in some ways with them in the
products,
market.
Right?
We were the first company to have a comprehensive well-being index.
Okay.
And so, what's interesting to me is not necessarily what the broader America and what communities are doing, but within your company, which divisions or departments or regions or worker types or job codes have high or low well-being. What are the health issues in your distribution center, say, versus your retail store? Those types of questions, companies love the data that we're giving them, and I'm sure other vendors here are giving them, is I want to slice and dice the data. I want to deliver targeted programs to all the people who are pregnant or who have diabetes or who have low back pain or who are in jobs that lift. So just having that information at their fingertips for the first time is so valuable to them. So that's probably the first thing. The second thing is well-being. We're seeing very linearly drives employee engagement. If you believe your employer cares about your well-being, 38% more engaged in work, 17% less likely to quit within a year. That actually has some real dollar savings associated with it.
Right, in terms of turnover.
So that equation is becoming a little more front and center at the conference and in the discussions in HR and benefits.
Well, and if you peel back some of the response you had before about stress being so prevalent, whether it's generated from the financial perspective, personal financial experiences and whatnot, and just this awful kind of coming through a recovery, but certainly just this blow in 2008 and just afterwards. With your approach, the approach of certainly your competitors and others out there, and really getting at the well-being, is that stress component something that could be dealt with more than just engagement? My question is engagement the only thing?
Well, luckily I don't run the government and I don't run the policies, and it's, obviously there's a lot more at stake.
Yeah.
I would encourage employers out there to think about stress not as a bad thing, actually.
Okay.
But think about the sweet spot of stress. There's a certain level of stress, which means you're interested in your job, you care. When you have an idea in the shower that's work-related, you write it down and bring it to work.
Okay.
That's engagement. So employee engagement and stress are highly correlated things.
Interesting.
And there's a sweet spot in there. And when you go below that sweet spot, you might call that sitting on the couch and eating chips all day and drinking beer, or depression or other things. When you're above that for too long, it's called I'm burning out and quitting my job and maybe having a heart attack en route. So finding the middle ground between those is what we're encouraging employers to look at. Not, did you eliminate stress from their life? That's totally unrealistic and frankly unscientific, and that's not how we evolve.
That's a really interesting perspective, and I know we're going to hear more about this certainly in the sessions I mentioned before in San Diego, that we're going to have a deeper dive at that version of this conference, which happens actually next week, and I know you're going to be there.
I will be there.
And I'll see you again. But you know, we're going to get into the topic of brain health and fitness, not just the physical fitness that a lot of people perceive as well-being is how do I physically feel, but also into the mind training, brain health and fitness. How does mindfulness weave into these stress reduction approaches versus stress elimination? So I think that's a very good distinction and a very good response, that we're not trying to eliminate stress.
Not at all. It's a resilience thing. It's
Yes.
Are you mindful?
Yes.
Are you resilient? Are you developing skills?
Yeah.
These are skills that are useful in tough sales situations, or when if you're in a hospital dealing with a sick patient. Those are skills you can develop. And we would argue that beyond those individual skills, you also need an organization that gets it, that supports it, that it actively invests in well-being.
All right, so last question I've asked of everybody as well as the first one is about the ACA. And you know, you obviously work with mostly large employers, you know, indirectly with some health plans, but question is, do you think no matter what happens with the election, and it's a very interesting election cycle obviously, what do you see as the prospects for, you know, really kind of having this resurgence in well-being, if you will, coming back to the love, actually get better?
Well, I mean, tying back to your earlier question about wellness and well-being, I think wellness might be a little bit disadvantaged with this, because the traditional wellness is like, let's deal only with health issues, whereas well-being, I think we'll see a huge emergence as it is in Europe and in Canada and other places where they have different systems of care. So even if we're kind of agnostic as a company. My own politics aside, we're agnostic about what happens in how companies are involved in paying for insurance, because they need to invest in well-being independent of whether they're sending people to exchanges or HSAs or CDHPs or whatever it is. So, what do I think is going to happen? I have no idea. We like the idea of consumers having choices and consumers owning their own health. I mean, if we can get a little bit more skilled in mindfulness in our own stress, and also take control of some of these decisions that affect our lives, we view that as a good thing.
Well, the good news is that you're in the Washington State, not the Washington, D.C., so you can watch it very, you can vicariously enjoy it, but from a different Washington perspective.
That's correct.
Well, thanks for joining.
Phil,
really appreciate it. Thank you so much.
Thank you.